Welcome, everyone, and good afternoon. And thanks so much for joining me to learn more about the safety and efficacy of COVID-19 vaccines. For those of you who I haven't had a chance to meet yet, my name is Karen Aiello, and I have the pleasure to serve as the Executive Director of the DuPage County Health Department. Before we get started, I'd just like to offer a few words that our County Board Chairman, Dan Cronin, wanted to provide.
Good afternoon. Thanks for sharing some of your time with our health department and our distinguished guests to learn more about COVID-19 vaccines and our efforts to keep you and our DuPage residents healthy. There's nothing more important to us than the health and safety of our people. And certainly, COVID-19 has posed our generation's most significant threat to our public health. But we are lucky. We are very lucky for many reasons. First, we have top-notch medical experts in our county and here within our own DuPage County Health Department, gathering and reviewing the data constantly as they develop best practices to defeat COVID and reduce its impact on your health. Secondly, we are fortunate to have access to extremely effective vaccines that work to protect us. And finally, we have access to peer-reviewed information and education as we are sharing today to help you separate the facts from fiction and the rumors. And that's the goal here. We want to answer your questions and provide the research-based information that you need to make decisions about your own health care. Let's face it, the COVID-19 virus has been shifting and changing over the past several months, and so too has our understanding of it. And between the headlines and the stuff we read online, it's hard to know who to believe sometimes. But let me assure you, the most reliable research-based information will always come from our own health department and our DuPage medical community, which is among the finest in the nation. This is your opportunity to learn and inquire and increase your knowledge about the vaccine so that you can move forward with confidence regarding your own health. Thanks for attending today's session. Now, I'll turn it over to our Executive Director of the County Health Department, Karen Aiello.
Thanks so much, Chairman. And I would like to personally thank Chairman Cronin, the County Board, and the Board of Health for their ongoing support through this COVID-19 pandemic. This unprecedented pandemic has been challenging for everyone. And since the beginning, we have been planning for the day a vaccine to protect us against the virus would be available. Today, incredibly, just over 13 months into the pandemic, 3 vaccines have received EUA authorization from the FDA, and 2 of them are being administered in DuPage County based upon some recent events that I'm sure we'll get into. The advancement in technology to produce these life-saving vaccines is a remarkable achievement. These vaccines have been through extensive clinical trials in more than 117,000 individuals of all ages from many racial and ethnic backgrounds. I do understand that many of us may have questions or concerns about getting a COVID-19 vaccine. We are here fortunate to have 2 vastly knowledgeable and dedicated doctors with us today to provide an informative presentation and answer your questions about the COVID-19 vaccine. First, Dr. Rashmi Chugh has served as medical officer of the DuPage County Health Department since 2003. She is board certified in family medicine and earned her MPH, Master's in Public Health degree in Health Policy and Administration. Dr. Chugh has served in leadership roles with the DuPage County Medical Society, the Illinois Academy of Family Physicians, and Ever Thrive Illinois. In January 2020, she was appointed by Governor Pritzker to serve on the Illinois State Board of Health. Joining Dr. Chugh is Dr. Kevin Most, who serves as the Chief Medical Officer and Senior Vice President for Medical Affairs at Northwestern Medicine Central DuPage Hospital. Myself, like many of you, probably know Dr. Most from his radio interviews with Spike Hodel and Steve Cochran, and now Bob Surratt on WGN. But what we didn't know is that his clinical interests include sports medicine, where he has provided medical directorship for over PGA Tour events, as well as not only serving as medical correspondent for WGN, but WGN TV, The Mix, and WBBM Radio. So before I turn it over to Dr. Chuk for her presentation, I'd like to ask Mila to provide us with a few housekeeping notes to assure an effective session. Rashmi or Mila?
Thanks, Karen. We are going to use Poll Everywhere, which is an interactive anonymous survey polling service, so that we can make the presentation as interactive as possible with all of you. If you have not used Poll Everywhere before, you have two options to participate. On the top of the slide screen, you can use the URL option of your computer, or I think the easiest option is to text from your phone. So to do that, you would open up the text screen on your phone, and you would direct the text to the numbers 22333. And then the text content area where the message goes, you're going to put Kim Siebert 009, and you're going to send that message. You'll receive a message back from Poll Everywhere informing you that you've joined the poll under Kim Siebert's session. And then as you see, we're going to get started with a survey question right away. So just take a minute to do that. And then one other housekeeping issue. If you haven't muted your phone, please, or your sound, please go ahead and do that. It'll make it a lot easier for everyone to hear the presenters. And I'm going to just repeat that number again. You're going to direct your text message to the numbers 22333. And then you're going to text Kim Siebert 009 in the message box. Thank you so much. And I see some of you are already joining the poll. So we'll give a minute for that poll to happen. And then Dr. Chug is going to start us off with her presentation. Thank you so much.
22333.
And just once again, go ahead and mute your sound if you haven't done that.
Okay, it looks like the poll is full. So now I'll turn the session over to Dr. Chug for her presentation. Thank you.
Thank you, Karen. Actually, Mila, did we want to answer the second question too?
Yes, I think that screen really quickly just went by. Let's go back one. There we are.
Great, thanks. And the code information is at the top of the slide for folks who may have missed it. All right, well, with that, I think we'll go ahead and get started. And thank you, Chairman Cronin, and thank you, Karen, and thank you, Mila. And it's my privilege to be here with you all today. Thank you, each of you, for taking the time and interest to learn more about COVID-19 vaccination. And to start with, and I'm looking so forward to joining Dr. Kevin Most in our Q&A session here shortly. But just to start with and kind of lay the landscape with COVID-19 in DuPage County, let's sort of step back and assess where have we been and where are we going. And here we have our this is a screenshot from our COVID-19 data dashboard for DuPage County. case activity. And you'll see here that, you know, we've certainly had, we had our spring wave last year, and then we had that really rough wave of activity with lots of hospitalizations and tragically deaths also in the fall and winter, and then came down pretty nicely. But now, as we're seeing, we've got this early, what appears to be a resurgence, but hopefully nothing like what we saw in the winter. And we thankfully have the resources, including vaccine, what we're talking about today. So we hope we never experience anything again like what we did in previous waves. That said, since last year, we have we received reports of over 85,000 COVID-19 cases among DuPage County residents alone. And that includes, tragically, over 1,300, it's 1,305 COVID-19 related deaths. And that is as of data from yesterday morning. And since then, we've sadly learned of a few more. But again, that's why we're all here, to learn about how we can prevent further case activity and hospitalizations and deaths related to COVID-19. Next slide, please. And I'm sorry, before we advance the slide, I just wanted to show what's highlighted on this slide is the breakdown of case activity by age group over time. And you'll see in the most recent increases that it's our young adults, our 20 to 39-year-olds that are dubiously leading the pack here, followed closely by our 40 to 59-year-olds, and then our our youth age group of 0 to 19-year-olds. And then somewhat reassuringly, we're seeing less of an increase in our population that has been where 80% or more have at least received one dose of vaccine in our elderly population. What we see in our in the green line is our 60 to 79-year-olds. And then at the very bottom, our 80 plus population, who has been most disproportionately impacted. And so hopefully, largely due to the high vaccination rates, we're seeing less activity in those age groups where the risk of severe outcomes is much greater. But nonetheless, we need to continue our efforts here to help protect our unvaccinated persons as well and get everyone vaccinated. Next slide, please. So let's start with the bottom line. The takeaways here is that COVID-19 vaccination is a safer way to build protection. We know that we get some natural immunity when there is natural infection, but we don't know exactly how much. And though we don't have a complete understanding of how antibody testing and how much of to what degree of protection that indicates, what we do know is from the studies so far that the antibody levels following vaccination are higher than those in persons who were naturally infected. So, so there's definitely a role and a recommendation for vaccination, even in persons who had previous infection. We also know that the risk of severe illness and death from COVID-19 are far greater than any benefit of immunity acquired from natural infection. So not worth risking it. So again, bottom line here is that COVID-19 vaccination will help protect you and your loved ones and each of us by building immunity without the risk of severe illness. Next slide, please. So hopefully this addresses some of the concerns about COVID-19 vaccination, but as we just said, it can help prevent getting sick with COVID-19. It also provides protection to those who have previously been infected or ill. And it also, COVID-19 vaccine does not give someone COVID-19 infection. It's there's not live virus in the vaccine. And for the same reason that it's not a live virus in the vaccine, that COVID-19 vaccines will not cause someone to test positive on diagnostic testing for COVID-19. Next slide, please. So we've been hearing a lot about COVID-19 variants, and what's happening is that we've had such a large number of infections locally, nationally, globally, that the more infection we have, the more viral replication we have, and the more replication we have, the more opportunity there is for the virus to mutate. And then the more mutations we have, then the more variants we have. And sometimes variants are not a big deal. They might just, there might just be a little bit of change in the lineage, and then they just may either die out on their own or not really cause any change in how easily it's spread or how virulent or how severe the disease might be. But as we're learning, there are a few variants of concern that are of increasing concern and increasing prevalence. In fact, everyone's likely heard of B117, the variant that originated in the UK, that just last week, the CDC director announced that B117 is now the predominantly circulating variant in the United States. So it has been found to be more easily transmissible, about 50% more easily transmissible. The good news is that so far it appears that our vaccines still, so far seem to be still effective against the variants, and also that we know what works. The same measures that work in preventing COVID-19 all along are effective, and if anything, need to be followed and adhered to more closely and to prevent spread, which is those measures, again, of course, being to wear a well-fitted mask correctly and consistently, to maintain physical distancing, particularly from people from different households, that people you don't live with, and then avoid large gatherings and crowds, and practice good hand hygiene, good hand washing. Next slide, please. So let's talk about how they work. One of the technologies in the Pfizer Moderna vaccines is they're basically mRNA vaccines. And this is where the vaccine carries genetic material that teaches our cell how to make a harmless piece of spike protein. And then this triggers an immune response so that if and when our body is exposed to SARS-CoV-2, the virus that causes COVID-19, that we've already generated that protection. Very important to recognize that this new technology of these vaccines, the vaccines do not affect our DNA, and the mRNA does not enter the cell nucleus. And as stated previously, it does not give someone COVID-19 infection. Next slide, please. The next technology is viral vector vaccines, which is the Johnson & Johnson or Janssen vaccine that was recently authorized in March, but as has been in the news in the past week, has recently, the CDC and FDA have recommended that COVID-19 vaccine use be paused of the J&J vaccine as they investigate and gather more information and develop recommendations on if and how it may be safe to resume administration, but at this time it's paused. But this technology of the viral vector vaccines also does not interact with our DNA and also does not confer infection to, or does not cause someone to contract COVID-19 infection. Next slide, please. So as the chairman was saying, we're so fortunate to have these vaccines in our arsenal now. The Pfizer vaccine and the Moderna vaccine were shown to be highly efficacious in their trials, in the clinical trials, 94, 95%. And important to note, even though we're hearing through ongoing studies that there's a pretty good level of protection even after one dose, but we don't know for what duration. And to really get the maximum protection, it's so important and critical to make sure that the vaccine is administered as it was studied and as recommended, to complete the 2-dose series with the recommended intervals, the 3 weeks between the 2 Pfizer doses or 4 weeks between the 2 Moderna doses. Next slide, please. Next slide, please. Thank you. So here we have a comparison, not of the, we know that all the vaccines are highly efficacious, and were found to be highly efficacious, but here what we have is kind of a comparison to show how well studied these were. That Karen alluded to this, that there have been, over 100,000 volunteers in each of these, or collectively in these studies, and They were geographically widely distributed, and with participation from various racial and with wide racial and ethnic distribution and representation that mirrors the community from where they were volunteering, and also from an age range perspective, very much representative of the populations that were most disproportionately impacted. Next slide, please. So one of the reasons I know the project was originally called Operation Warp Speed, and I think while speed was a big part of it, but the warp part I think maybe inspired some concern. But I think very important to recognize that the reason we were able to move forward so quickly was because the federal government invested upfront, not only like as soon as there was a vaccine candidate that seemed viable, then the investment was made to manufacture vaccine alongside the clinical trials being underway. So that way, if and when a vaccine made it through phase 3 and then was ready to submit for application of emergency use authorization, they were ready to go with the supply. And that's why we were so fortunate to be able to have vaccines authorized and distributed. And because of that government level investment, these vaccines are provided at no cost to anyone who is eligible and willing to receive it. So as highlighted at the bottom there, no one can be denied vaccine if they are unable to pay, and no individual should be billed for vaccine. Insurance can be billed to help the healthcare provider cover operational costs and overhead, but no individual is billed for COVID-19 vaccine. Next slide, please.
Hear that, Tun?
I do know. I'm gonna listen.
And just a reminder for folks to please mute if you're not already. And here we have, so now we have authorized vaccines, and what can we expect before, during, and after? So here we are learning about vaccine in case for those of us who haven't yet been vaccinated. And we want people to keep up on who's eligible for vaccines. During your vaccination, you want to make sure you read the fact sheet that you're provided. Those are available online as well. And then you'll receive a vaccination record card at the time of your vaccine administration. And then afterwards, this is important. As your body is developing immunity, it is not unusual. In fact, it's more common than not to have some side effects. Thankfully, these are short-term side effects, and the most common side effects being fever, chills, fatigue, might have some body aches or headache. And at the injection site, you might have some local side effects such as soreness or redness or swelling. And typically these appear and resolve just in the first few days. They resolve by day 3. It is very unusual for any side effects to appear more than 8 weeks after vaccination. And we have many safety monitoring systems in place. VAERS, the Vaccine Adverse Event Reporting System, has been in place for decades. And then more recently, CDC developed this vSafe smartphone-based monitoring system specific for COVID-19 vaccine safety monitoring. And of course, very important for anyone, irrespective of vaccination status, to continue practicing the safety measures of masking and distancing and washing your hands. Next slide, please. Next slide, please. Thank you. Just an important quote here from Dr. Walter Orenstein, kind of a giant of immunizations in the US and globally. Reminder that, you know, we can have all the vaccine supply in the world, but if they're not being administered into arms, people won't be protected. So it's not vaccines that save lives, it's vaccinations that save lives. Next slide, please. So what's happening in DuPage County? Speaking of eligibility, we started in December, late December, with phase 1A, who were the phase 1A group prioritized healthcare personnel and persons aged 55 years and older. And this was really based on the prioritization has been stratified by risk of exposure and risk of severe outcomes. So that explains healthcare personnel being at greatest risk of exposure, and then those 65 and older at greatest risk of severe outcomes. And then we've progressed on to phase 1B, frontline essential workers, and those age 60, for phase 1A, I misspoke. It was healthcare personnel and long-term care facility residents. And then that progressed to phase 1B of frontline essential workers in those age 65 and older, irrespective of where they reside. And then phase 1B plus was the more recent expansion for those age 16 to 64 with one or more underlying medical conditions that increase risk for severe COVID-19. And then of course, other frontline, or beyond frontline, other essential workers who weren't captured in phase 1B. And then just on April 12th, effective just this past Monday, we've entered phase 2. So anyone who is 16 and older who would like to be vaccinated is eligible to receive vaccine. So that's where we're at, and everything is contingent on supply right now. And actually, next slide, please. We'll talk about this a little bit more. We're so grateful to all of our partners, our healthcare and health system partners in DuPage County. Thanks to everyone's participation and really stepping up, we've developed a very robust network of vaccine providers. And so as the local health department, we receive the supply. There are also federal allocations and state allocations that go directly to some pharmacies, but there is a significant supply that we've developed that the health department and and the DuPage County health systems, and including individual medical providers and smaller family-owned pharmacies, as well as pharmacy chains, as well as our first and foremost, our hospitals and again, our health systems have really invested resources and time and staffing to provide vaccine to not only their patient populations, but often even beyond into the community. So here we have this great capacity, and gradually our supply is increasing to be able to vaccinate more and more of our population every day. Next slide, please. So again, there's been a lot of fluctuation in the supply received on a weekly basis, anywhere from, less than 5,000 some weeks of doses, and then sometimes over 20,000 doses. So it's been fluctuating, and this week is actually, this slide is a couple days old, but this week is fortunately looking up. So we are beginning to experience vaccine supply opening up, even with the pause on Johnson & Johnson. We continue to fortunately receive thousands of doses of the Pfizer and Moderna vaccines. Next slide, please. So when we receive the allocation and then have to determine how this vaccine can be distributed throughout the community, some of the considerations that factor into the decision-making that occurs regularly is based on the Centers for Disease Control and Prevention's Social Vulnerability Index, and that's reflected here down to the census tract, with the darker shaded areas reflecting areas of greater need. And what's incorporated in SVI is a consideration of 15 social factors, including unemployment, minority status, and disability. And so again, that's the map for DuPage County. And so we look at that and see, based on provider location and access, and how we can support improving access to COVID-19 vaccine. Next slide, please. Again, just to give you a sense of the progress that we're making together here is that we have now exceeded 25% of the DuPage County population being fully vaccinated. So we're not where we need to be, and we don't know exactly what herd immunity is. It's probably somewhere between, I think, probably between at least 75 and 90%. I think I've heard Dr. Fauci mention, but and probably, as high as possible, particularly with variants circulating, because it's even more easily spread. So, so we're on our way though. So at least we have over 25% of our population fully vaccinated. Next slide, please. And here's some additional demographics from the, or some additional progress on vaccination for DuPage County residents that's on the IDPH page. And so we want to make sure that we're tracking our progress, particularly in our racial and ethnic minorities, many of whom have been disproportionately impacted as well by COVID-19. So we want to make sure that they are, that we're administering vaccine not only efficiently, but equitably. Next slide, please. So how does one get vaccinated? As many of you are aware, but in case you're not, you sign up on our page which is dupagehealth.org, COVID-19 vaccine. And anyone can register, anyone who is interested in being vaccinated. And then as soon as supply is available and we continue to prioritize based on the individuals within 1A and 1B and 1B plus who have not yet been vaccinated, but certainly a lot of progress is being made, not only at the DuPage County Health Department Community Vaccination Clinic, where it's a phenomenal operation that's being run like a well-oiled machine, crossing new records. And I think similarly at our health system partners who have expanded capacity as well to administer thousands of doses every day in DuPage County. But really, there are multiple resources available, whether it's signing up on our website to register, and then you would receive a notification with a scheduling link when a slot is available. And then also contact your primary care provider, or you may have received outreach from your health system, and also check at local pharmacies to see if and when they have availability. So really good to get vaccinated at the first opportunity, and good to get the first vaccine. The best vaccine is the first vaccine you can get. Next slide, please. And to help address the digital divide for anyone who may not be able to access appointment scheduling online, we've established a call center here, which is our health department number, and then you can be directed, and multi-language assistance is available too. Next slide, please. Great to celebrate our champions. Nationally, we have Dr. Fauci, and locally we have Karen Aiello, our esteemed health department director. And good to celebrate and share the opportunity and responsibility that we have to help protect our community, ourselves and our community. Next slide, please. And I think each of us, we're all county employees, and I think most, if not all of us, have, at some point during the pandemic, gotten questions from our social circles or friends and family, basically saying, "Hey, you work for the county, what's going on?" And so I think we each have the opportunity, and really each of us play a pivotal role in communicating and bettering understanding of COVID-19 vaccination. So why we're here today is to really help you understand the value and importance of getting vaccinated. So very important for each of us to choose to get vaccinated, and then to engage others in your sphere of influence in effective conversations, and then also be prepared for questions either that you can answer or know reliable resources to refer folks to. Next slide, please. And we kind of talked through this about very important I'll just focus on that middle one, very important to convey your strong recommendation to get the vaccine. Next slide, please. And to listen actively. So here are some of the questions and misinformation that we want to make sure we address, that COVID-19, again, cannot give you, the vaccines cannot give you COVID-19 infection, and that they won't cause you to test positive, and that persons who were previously infected can definitely still benefit from getting vaccinated. Next slide, please. This is important here. So if for women of childbearing age, this is a very frequent question. And unfortunately, there's been a lot of misinformation and disinformation circulating in social media. So question, if I'm planning to get pregnant, should I get the COVID-19 vaccine? Yes. And this is most recently and clearly answered by the American College of Obstetrics and Gynecology, ACOG. So clearly communicating that there is no mixing of DNA between the vaccine and our DNA. There's no persistence of vaccine material in the body. It breaks down, within hours of administration after, kind of the instructions are relayed to our cells. Fortunately, also, there are no adjuvants or preservatives in the vaccines. There's no chance to, again, get infection from the vaccines. Of the tens of thousands of pregnant women who are being monitored through VSafe, and also in all the adverse events that have been reported through VAERS, there's no reported increased risk of miscarriage in the data thus far. What we do know is that there are increased risks associated with COVID-19 infection in pregnancy. We know it can lead to preterm birth of the infant, and also it contributes to increased risk in maternal hospitalization, ICU admission, the need for ventilatory support, as well as death. So the benefits of COVID-19 vaccination far outweigh the risks associated with COVID-19 infection. Next slide, please. How long does immunity last? We don't really know yet. We anticipate several months, but studies are ongoing, and we'll learn in the coming months and years if and when a booster is indicated. Next slide, please. And what can individuals who are fully vaccinated do safely? And so this is a nice list provided by CDC of what you can do when you've been fully vaccinated. Basically, you can visit with other fully vaccinated people or with other persons who are of low risk, who have not yet been vaccinated, such as grandparents who have been vaccinated can visit with grandchildren who may be low risk, who have not yet been vaccinated, since there's not a vaccine authorized for the pediatric population yet under 16. And then there's also a bit of loosening of testing and other recommendations regarding travel. Next slide, please. But very important to still continue to, in public settings and in settings of mixed households, such as workplaces, to continue following the necessary precautions of masking and distancing and hand hygiene. Next slide, please. Should clients who have allergies receive the vaccine? So there are, the only contraindications for someone to receive vaccine would be if either they had an anaphylactic reaction, like a severe allergic reaction to the first dose, then they should not receive a second dose of that same vaccine, or if they have a known severe allergic reaction to any of the vaccine components. But other than that, if someone had an allergy to a medication or to a food product, then it's still recommended to get vaccinated, but depending on the type of anyone who's had a severe or immediate reaction to something other than the vaccine ingredients would be advised to be monitored for 30 minutes instead of the usual 15-minute observation period. Next slide, please. I think this is our last one before we open it up. Can I get the COVID-19 vaccine if I have asthma? Yes. In fact, it's recommended. Asthma, as well as any other underlying condition such as diabetes or COPD or heart disease. These are all conditions that can get worse with COVID-19 infection. So very important to still get vaccinated, as long as, again, just as long as there's no severe allergic history of severe allergic reaction to the vaccine or any of its ingredients. Next slide, please. So maybe we'll do the poll quickly. Sorry, go ahead, Mila.
Yes, I think we're going to take a minute to do 2 poll questions that are follow-up from the.
Actually, Mila, can I ask a question? Can we proceed with the Q&A and then have this in the last couple minutes?
Yep, I'll just remind myself to save a minute or 2 at the end here. Okay, everyone. So What we're going to do now is bring Dr. Chug and Dr. Most forward to answer questions that have been submitted ahead of time. And then also there's a couple that were put into the chat. So I'm going to incorporate those into the questions and we're going to get started. I just want to make sure Dr. Most has his sound working and that we're good to go with both of you.
Yes, I can hear you.
Welcome, Dr. Most. How are
Well,
you?
thank you.
Okay, so the first questions we're going to start with are about safety. And some of these have been addressed in the presentation, but there's some deeper questions here. So the first one is, we just heard that the CDC had paused J&J. Can you talk a little bit more about why, and if you think that pause will be extended?
Sure, Rashmi. Rashmi and I have done tag teams on this throughout this past year, so I'll definitely jump in where I can. It is kind of unfortunate. J&J is paused right now, and CDC actually just announced today that they're going to pause for another 7 to 10 days. The reason for the pause is they found 6 females that had blood clots noted within 2 weeks of being vaccinated. One responded in a death, and one is in critical care. We have to understand that 6 to 7 million individuals received the J&J vaccine. So this was, you hear 1 in a million. This was actually truly 1 in a million. The couple things I want to get across is we have more individuals who have blood clots who get COVID. So do not take this as a reason to not get vaccinated. Blood clots are one of the side effects of the illness, and we know that that occurs in lungs as well as in legs with people with COVID, so we certainly want to make sure they get vaccinated. It's unfortunate that it was held back. You may have looked at the results and said, well, it was only 72% effective anyways, but you have to remember when you looked at the testing, Moderna and Pfizer were not tested against variants, where Johnson & Johnson was tested against the South African variant and the British variant. So that efficacy rate of 72% is still very positive. We're very fortunate in this country that even with the pause of Johnson & Johnson, it may not impact us much because of the increased production of Pfizer and Moderna. We didn't even take a skip here at CDH. We had a Johnson & Johnson scheduled for today. We flipped them to Pfizer, and we have 1,100 people getting vaccinated. And Rashmi, I don't know if you wanted to add anything or what I missed.
No, that was I think you summed it up very nicely. Thank you.
Okay, thank you. The next question is, with different vaccines being offered, and we know the message has been, you should get the vaccine that's available to you. But if you have pre-existing conditions, is there really one that might be better than another for you?
No, I would say, take the recommendations right now. I'm sure many people, even if the CDC says it's okay for Johnson & Johnson to move forward, many may be hesitant there, but certainly the vaccines that are available right now, Pfizer and Moderna, both very highly effective. And we have to remember that these effective rates are showing that the decrease in the number of hospitalizations and deaths. So when you're hitting these rates of 95, 94%, believe me, you're splitting hairs if you're saying, I want to wait for Pfizer at 95 versus Moderna at 94. Please get the vaccine that you can, and it works on a good timeline for you when you're available to get it.
Thank you.
Agree.
Dr. Chug, anything?
Yeah, I would just add that I think, as Kevin was saying, that the CDC has stated no preference for one vaccine over another other than the age range. So certainly Pfizer goes down to 16 and older, and then Moderna at 18 and older, and Johnson & Johnson was also at 18 and older. And so we'll see what they come back with. But I agree. I was just going to mention, as Kevin mentioned, that the efficacy in the trials was not as high, like it was in the 70s and not in the 90th percentile, but it was in the 90th or even 100% effective at preventing severe outcomes, including death related to COVID-19. So again, we're so fortunate to have more than one option with COVID-19 vaccination.
And a follow-up to that question, Dr. Chug, someone had asked, is this like the flu shot where you get this vaccine and then there is a chance you may still get COVID, but you would have a milder case or perhaps even be asymptomatic?
So that's a great question. And at least based on early reports and observation, yes, that seems to be the case. And I would say even, and that's part of the efficacy that informed the trials, that that it was, a very high, that there is a high level of efficacy in preventing disease. But what we're learning, well, and in the trials, they also then measured how effective it was at preventing severe outcomes, such as hospitalization and death. And then what they're further studying is if it's effective in preventing spread. And ongoing preliminary studies are indicating that it is also highly effective at preventing infection and spread. So even in persons who might be without infection or without symptoms. But yes, what we are seeing, we have learned in DuPage County of about just over 30 cases of what we call vaccine breakthrough cases. And of those vaccine breakthrough cases, so far, one has been hospitalized. Thankfully, no deaths at this time. And of the remaining 30 or so cases, they've all been mild and managed as an outpatient. And some have even been without symptoms, but just picked up through screening, testing in their workplace, since many are healthcare personnel.
Thank you. And there's another question that goes with that, so I'm going to ask it now. Do you see any, through that sample or anything else you've seen, both of you have seen nationally, is there any trend or anything saying that people that have breakthrough cases, whether they're asymptomatic or they're getting sick, that they have pre-existing conditions, or it's one vaccine over another? Is there anything that you can say about that?
I can just start that we don't have the data yet. I think it's still very early in collecting and understanding vaccine breakthrough so far, but I would say, generally speaking, to the earlier question, that so far we're seeing that if someone does still get infected, it's generally less severe and of a shorter duration. Kevin, anything you'd like to add?
Yeah, I would say that the breakthroughs, the other big thing that we're doing is we're testing to see if it is actually the variant or was it the original novel COVID. So that will give us more idea on how effective the vaccine is against the variants. We certainly, if we're going to have breakthroughs, we would rather see them on some of the variants than we would on the original. But that being said, we're starting to see more of the UK variant being predominant, which both Pfizer and Moderna tested very well against. So that's very promising.
Okay, thank you. A couple questions about side effects. How long should someone expect to feel side effects? And we've talked about what are some of the most common side effects, but specifically regarding something like a sore arm or lymph nodes and things like that, how long should someone expect those side effects to remain after the vaccine?
Mila, it's interesting, and thanks for the question, but it's very interesting because I've had more people probably ask the other question. I didn't have any side effects. Is the vaccine still working? But for your question, there's a couple of very key points in there. One, we really expect the side effects to last 24, 48, maybe 72 hours. And it's going to be a little bit of discomfort. Many people causing discomfort in the arms, some people having low-grade fevers, body aches and lethargy. But I would say push fluids, rest, as you would do with any common cold or illness. And these are fading very quickly. Probably one big message that we really want to get across, though, and you mentioned it briefly, is that this vaccine can sometimes cause a swelling and inflammation of the lymph nodes. So any female who is getting ready to have a mammogram, we're going to ask that you either get your mammogram prior to your vaccine or postpone it until post-vaccination. We don't want to have a false positive mammogram, increase anxiety and increase something because of the vaccine. That being said, we certainly do not want to postpone any screening mammograms going forward, as we've already missed quite an opportunity over this past year.
Thank you. The next question is about after you've received the vaccine, is it still possible that you could transmit COVID-19 to those that haven't been vaccinated? And do you know of cases like that?
Go ahead, Rashmi.
Okay, I can start by saying that, yes, it is still possible because as we just talked about, we know that we've had dozens of vaccine breakthrough cases, meaning infection identified in persons who have been fully vaccinated, meaning that they were more than 2 weeks past the recommended series, whether it was 1 dose or 2 doses per the vaccine. So yes, we know individuals can be vaccinated or can be infected after being fully vaccinated. What we don't necessarily know yet is we don't have identified outbreaks or anything, but we definitely know that there's the potential for any infected person, vaccinated or not, to transmit disease. What they're looking at to see is, for example, is the viral load lower in someone who's vaccinated? So maybe are they less likely to transmit even if they are infected? And I think there's some preliminary studies suggesting that, but no official recommendation or no official findings that state whether or not someone who's fully vaccinated doesn't need to worry about transmitting it. I think because we don't have complete data yet, the recommendation stands for fully vaccinated persons, particularly in public settings or settings of mixed households, persons from mixed households, to be following all the same safety measures. Kevin, anything else on that?
Yeah, I would just say we have to remember that a vaccine is not like an antibiotic where when you take it initially, it starts working. We know that after the first dose, you're going to get somewhere between 60, 70% protection, but you get that big protection about 14 days after the second dose. That being said, you've got a range there of about 40 days, 45 days, where you still could get infected and spread because your immune system has not kicked in enough. And it's interesting now when we talk about masking now, those who are fully vaccinated have to remember that you have great protection for yourself. And the reason we're going back to masking those individuals is to protect others. Because as Rashmi said, we're still trying to figure out if the vaccinated person could still be an asymptomatic carrier and spread. So please at least do that out of courtesy. And also I can tell you just out of the social nature of it, someone that you interact with that if you don't know well, you don't know if they've been vaccinated. So the tension and the social tension can kind of increase. So until we get to that point of 75, 95%, let's make sure we're still all masking and distancing appropriately.
Thank you. We have about 5 minutes left. I'm going to ask a couple more questions. And this one has come up quite a few times. If I've had COVID or even a severe infection of COVID, is it still recommended that I get the vaccine? And if so, is there a timing to consider once the symptoms of my COVID infection have gone away?
Well, we're certainly going to tell you to get the vaccine. And if you look at the studies and what has gone on, individuals that have had COVID, as Rashmi said, the natural immunity is great, but we can actually prove that the vaccination immunity is even better. Those individuals who have had COVID and then get vaccinated have about a 10-time the immune response rate. So those individuals, I would say, boy, please get vaccinated. We don't want you to get vaccinated while you have symptoms. We want to make sure that the infection has cleared. So 10 to 14, some people are even saying 30 days post-COVID infection to get vaccinated, at least get in line. But certainly we know that you're going to get a much bigger response. Some people say, will my side effects be more or less? It really depends on the individual, but certainly do not let just the natural immunity take the opportunity to get the full immunity that you can with the vaccine.
Agreed. You definitely don't want to be within your isolation period, so that minimum 10-day period, and then you don't want to be acutely ill in case you have lingering symptoms. So as soon as you're feeling well enough past your isolation period, as Kevin said, register, get in line, and so to speak, and get your vaccine.
Thank you. This next question is going to be about taking care of yourself after you receive the vaccine. So after you've been vaccinated, is there anything you should or shouldn't do so that you can achieve the best immunity? And specifically, the question asks, should I avoid taking Tylenol or ibuprofen or Aleve, to kind of deal with those symptoms and side effects?
Go ahead, Kevin.
Okay, certainly, one of our recommendations are that we don't take any anti-inflammatories prior to getting the vaccine. But certainly after the vaccine, take any medications that are going to make you feel better. And everyone should really look at their immune system and make sure that their diet is appropriate to increase their immune system. Make sure that you're getting the appropriate vitamins. During the winter here in Chicago, we get very, very little vitamin D naturally. So we know that vitamin D is not a treatment for COVID, but we certainly know that vitamin D is something that's going to help our immune system. So take anything that's going to make your symptoms go better. Keep your fever down. You having a fever after a vaccination does nothing for your immune system. It does nothing to slow, but certainly makes you feel worse. It increases your chance of dehydration. So certainly do all those things to minimize the side effects, but please don't do anything prior to the vaccine.
Thank you. One last question, and then don't get off without answering those 2 polling questions, guys. This last question is about, and this one's a tough one because the COVID vaccines are new, but based on your knowledge of other vaccines, are there any long-term effects of the COVID vaccines that you are anticipating or that people should be concerned about?
I'm not aware of any that have yet been reported, and the studies are ongoing. That's why they continue the cohorts of persons that were vaccinated of the volunteer groups, and then they've offered vaccine to those who received the placebo or weren't vaccinated, and they continue to study all of them. But Kevin?
Yeah, Rashmi, I'd say you're spot on. This vaccine is probably going to be the most studied vaccine in the history of vaccinations. So certainly one of the questions earlier about, will I need a booster, or how long will this last? Right now, we're continuing to study those people that were in the clinical trials. And even after 6 months, we're seeing over 90% in the Pfizer, and Moderna, I believe, came out earlier this week with very similar numbers of protection. So long-term, I'm not sure how long the protection is going to last. But as far as long-term side effects in that, I can tell you that the long-term side effects from COVID have certainly come out in this short period of time. And yet we have not seen any long-term side effects or any side effects beyond the inconvenience and the pain and a little bit of a fever from the vaccine.
Correct. I believe it's 1 in 3 with COVID infection have some long-term effect from it. So a long-term complication from COVID-19 infection. But as you said, nothing reported yet in long-term effects of COVID-19 vaccine.
And just one follow-up to that, the mRNA vaccines, although they're new to the public, they actually have been studied for quite some time. So in terms of worry about or concern about that, if you could just mention a thing or two about the length of time they've actually been studied.
Go ahead, Rashmi, you can
Over a decade. They've been part of different vaccine trials, and but yeah, the vaccines are new, but the technology is not. They've been part of different vaccine trials for many years.
And when we look at these new illnesses coming up, they're using mRNA. So you hear about Ebola, you hear about Zika. Yeah, those are the ones that they're really working on. And the beauty of mRNA is they can change. When people are concerned about variants now, the mRNA can change to a variant much quicker than they can with the adeno-based viruses. So we have much more opportunities to keep our protection up as we go along and as this spreads out.
Thank you very much, Dr. Chuk and Dr. Mose. This has been really informative. Your knowledge and wisdom is excellent for us to be able to have live today. So thank you so much. We're going to move on to those 2 polling questions. And Kim, if you just want to bring those slides up, people can answer 1 question and then the 3rd one, and then we're going to move to the 4th question. And then I believe we're going to conclude for today.
So the 3rd question being, as this session is ending, how likely are you to get vaccinated against COVID-19? So that's for you yourself.
And then we can probably move to the 2nd one. There we go.
Question 4 being, as the session is ending, how likely are you to recommend getting vaccinated against COVID-19 to your family and friends?
Thank you very much, everyone. We really appreciate your time today.
Great, thank you.
Thank you.
You.